My experience, at least from an outsider who's curious about this but doesn't study it the way you do, is that it gets a little more complicated and complex when you get into really big either companies, healthcare entities, governments, any or all those. It just seems like it's difficult for leaders to grab the microphone and say, "Hey, everybody, I got to talk about a way how I screwed up a decision last week." And I know you've got even background in even studying and working with healthcare.
Right.
So I'm curious, do you see it varying a little bit, either based on size or industry?
I think it comes down more to the mindset of leaders and senior leaders, or the CEO of a hospital or the CEO of a health system. I'm not saying they're the only one who matters in terms of what they say and what they do, but I think they tend to set the tone, for leaders at other levels. There's a lot of history and hierarchy in healthcare. History of people being trained not to admit a mistake and to be infallible, in particular physicians. But I think what's interesting, I mentioned Greg Jacobson from KaiNexus. He is also an emergency medicine physician. That is his background. That is his training.
Interesting.
And, he tells stories about, being an ER doc and asking a nurse who was also seeing the patient and realizing the nurse is spending more time with the patient. I don't think it would come from a lack of confidence on his part, but Greg would ask nurses what they think about the patient's condition, prognosis, diagnosis. And he said sometimes nurses, if they didn't know him, they were afraid to speak up, not because of him, but because of their own history of maybe the doctor's testing them so they can say, no, you're wrong, and belittle the nurse. That would be unfortunate. And Greg had to help people understand. He was asking the question in sort of a straightforward, I'm asking because I care. I want to hear your opinion. So I think when leaders sort of try to help set the tone in different ways, that's really helpful. Now, in healthcare, there's another dynamic, or we can think about other situations where, let's say, if I launch a website and there's a little mistake, nobody dies, right? I mean, what's the worst that could happen if I make a mistake? It's imperfect. Okay, I can fix it. I can improve. Life goes on. In healthcare, or let's say in aviation or in certain manufacturing settings, a mistake could be harmful or deadly, right? So this idea of saying, well, we need to admit mistakes and learn from them, that's not intended to be permissive, because again, mistakes are unintended by definition. But when we have a culture, and this is a story, an example Greg shared from the healthcare side, if somebody almost gives the wrong dose of ibuprofen to a patient, let's say 60 milligrams instead of 40, and they caught that mistake and didn't give the wrong dose, that's an opportunity to learn and improve. That's a mistake, right? It was caught. It was a very minor mistake, but we shouldn't react just based on the level of harm. If we're too busy or dismissive, or we say, well, okay, we didn't give the wrong medicine, so it wasn't a mistake, but we almost did. If you don't seize that opportunity to admit it, to learn, to improve and move forward, the next time those same circumstances might lead to a mix-up in medications that is harmful or fatal. But healthcare is still struggling to get past kind of this old hierarchical, punitive approach to mistakes. That makes people really afraid to speak up about the little ones, which then kind of dooms everybody to bigger mistakes than happening.